Hello everyone, I'm Dr. Hiba Samir. Today I'm going to talk about thyroid cancer. Let's start our talk about simple case scenario about 45 years old lady who presented with a neck mass. Notice while she's wearing her necklace. It was totally painless lump. There was no long-standing illness since before and no significant past history. The patient denied any symptoms of cough, breathing difficulty, change in voice, or painful swallowing. As the patient was concerned and worried, she booked an appointment to visit her doctor. After examination and investigation, the result was, unfortunately, thyroid cancer. So, what is the thyroid gland? Thyroid gland is one of the glands in the body that's located at the front side of the neck, below Adam's apple. It looks like a butterfly as it consists of two lateral lobes connected with an isthmus. At the back side, there are 4 parathyroid glands. The nearby structures are the voice pipe, which is known as the larynx, and windpipe, which is known as trachea. Thyroid gland is responsible for production of essential hormones, thyroxine, triiodothyronine, and calcitonin into the bloodstream. Those hormones are mandatory for normal growth, development, and body metabolism, especially during infancy and early childhood, such as regulating body temperature, heart rate, and blood pressure. Almost all systems in the body depend on thyroid hormones. Thyroid cancer is the commonest endocrine tumor. There are different types of thyroid cancer, depending on the cancerous cells originating from and the looks or the morphology of the cancerous cell. The majority of cases are due to papillary carcinoma, which originate from thyroid follicular cells. The other type is follicular carcinoma, which represents about 10% of all thyroid cancer cases. It also originates from thyroid follicular cells. Miliary carcinoma, it represents about 2 to 4% of all cases. It originates from parafollicular cells or C cell. The last one is the anaplastic carcinoma, which accounts for less than 2% of all cases. And this is the worst type of thyroid cancer. Thyroid cancer is due to growth of genetically damaged cells. Those cells start to grow and accumulate and form the tumor. What are the causes of thyroid cancer? Most of the cases of thyroid cancer have an unknown cause, but there are some associations or risks contributing to the development of thyroid cancer, such as being female, middle age, exposure to radiation during childhood period, family history of thyroid cancer, obesity, and some genetic syndrome. Most of the cases of thyroid cancer present with no symptoms. Only the patient will come with incidental finding of thyroid lump. Other patients are found to have those lumps while imaging study for other reasons. Some patients will present with symptoms of compression or invasion of nearby structure, such as coughing, difficulty breathing, change in voice, and difficulty in swallowing. The doctor will need to take full history, proper clinical examination, and to do some blood tests and imaging study, such as sonography and biopsy, to confirm the diagnosis and make the staging properly. The treatment of thyroid cancer. The goal of treatment is to remove the cancerous tissue and to prevent the spread of the cancer. It is individualized treatment because patient circumstances are different, staging are different. Thyroid cancer treatment. The mainstay of thyroid cancer treatment is surgery, either through removal of half of the gland, known as lobectomy, or the total gland, whole gland, known as total thyroidectomy. The other adjuvant therapy are thyroid hormone replacement, which are pills taken to prevent or suppress what we call thyroid-stimulating hormone to prevent the growth of cancerous thyroid tissues. The other adjuvant therapy is radiolabeled iodine therapy, Also, there is external beam radiation therapy. Those therapies are directed toward the remnant of cancerous tissue. So they will kill those tissues and prevent growth of cancerous tissues. Some patients present in advanced stage or they do not respond after surgery or adjuvant therapy. In this case, the doctor will start chemotherapy. At the end, thyroid cancer is relatively rare, but it is the commonest endocrine cancer. The surgery is the treatment of choice of most of thyroid cancer. Thank you for listening.